Sigmund Freud 1856-1939. Birthplace and his significant family and childhood experiences.
Sigmund Freud was born in Freiburg, Moravia, now Czech Republic, on May 6, 1856. Sigmund was the first child of his father's third marriage after he had been twice widowed. Amalia Nathanson, his mother, was 19 years old when she married 39 years old Jacob Freud. Sigmund's two stepbrothers from his father's first marriage were about the same age as his mother, and Sigmund's earliest playmate was his eldest stepbrother's kid, Sigmund's nephew. As a result, the youngster grew up in an atypical family structure. The family moved to Vienna when he was 4 years old, and around this time, his sister Anna Freud was also born. A brother born between them, Julius, died at 7 or 8 months of age. They had 5 additional children between 1860 and 1866, shortly after moving to Vienna, namely Rosa, Marie, Adolphine, Pauline, and Alexander. This resulted in continuous financial troubles, which the young Freud appears to have found upsetting. Sigmund remained his mother's favorite despite the birth of 7 other children.
Relevant educational background.
From 1866 until 1873, Freud attended the local elementary school, then the Sperm Gymnasium, a secondary school in Europe where students prepare for college in Eupolgia. He excelled at Greek and Latin, as well as mathematics, history, and natural sciences. At the age of 17, he completed his final exam with flying colors, enabling him to attend the University of Vienna. He was particularly interested in physiology and neurology. And also, the young student was originally drawn to laboratory and scientific side of medicine rather than clinical practice, since Vienna had become the international center of medicine. In 1881, he earned his medical degree. Furthermore, he spent 7 instead of usual 5 years acquiring his doctorate. Freud received his Doctor of Medicine degree at the age of 24.
Important contribution in the theoretical concepts of personality.
Freud's attention was captured by a colleague's intriguing experience with a patient. The colleague was Dr. Joseph Brewer and his patient, the famous Anna O. Dr. Brewer found that her symptoms abated when he helped her recover memories of traumatic experience that she had repressed or hidden from her conscious mind. This case sparked Freud's interest in unconscious mind and spurred the development in some of his most influential ideas. Freud's model of human mind was perhaps his most influential concept. In his approach, the mind is divided into 3 levels or regions, namely the conscious, the preconscious, and the unconscious. Later, Freud posited a more structured model of the minds. According to him, our personality develops from the interactions among what he proposed as the 3 fundamental structures of human mind, namely the ID, the ego, and the superego. This theory, known as Freud's structural theory of personality, places great emphasis on the role of unconscious psychological conflicts in shaping behavior and personality. Freud believed that these 3 parts of mind are in constant conflict because each part has a different primary goal. Sometimes, when the conflict is too much for a person to handle, his or her ego may engage in one or many defense mechanisms to protect the individual. These defense mechanisms include regression, denial, projection, sublimation, displacement, and repression. Freud believed that the nature of the conflicts among ID, ego, and superego change over time as a person grows from child to adult. Specifically, he maintained that these conflicts progress through a series of 5 basic stages: the oral, anal, phallic, latency, and genital. He called this idea the psychosexual theory of development. Across these 5 stages, the child is presented with different conflicts between their biological drives and their social and moral conscience because their biological pleasure-seeking urges focus on different areas of the body, also known as the erogenous zones. The child's ability to resolve these internal conflicts determines their future quality to cope up and function as an adult. Failure to resolve a stage can lead one to become fixated to that stage, leading to a unhealthy personality trait. And successful resolution of the stages leads to a healthy adult. Another well-known concept from Freud was his belief in the significance of dreams. He believed that analyzing one's dreams can give valuable insight into unconscious mind.